Welcome back. In this lecture, we're going to discuss the process of digestion, but I want to start out by giving you an example that maybe you've experienced yourself. Have you ever been on pain medication, narcotics after surgery, and had the untoward consequence of constipation? Well, this process of digestion, simply stated, takes the food that we eat and makes it available to our bodies for the energy and the nutrients that we need. It goes unnoticed and often underappreciated unless there's a digestive disorder. So that pain medication causing constipation is just one example of what happens when there's an alteration in the process of digestion. Most Americans have had a digestive disorder sometime during their lives, and according to the National Institutes of Health, between 60 and 70 million Americans are affected by digestive diseases. Probably the two most common are constipation and diarrhea. So this lecture is going to focus on the basic functions of the gastrointestinal tract, taking us from beginning to end, some of the common ailments, and some of the dietary management strategies for the diseases of the gastrointestinal tract. And to start out, we're going to start out in the mouth with something that's very simple, something that we don't think about most days, and that's the chewing of our food. In our mouth, chewing food breaks it up into smaller pieces, and it moistens the food, and it introduces a compound called salivary amylase. And salivary amylase digests carbohydrate. So that means that amylase is a digestive enzyme. Anywhere you see that last three letters of ASE, that's going to tell you it's an enzyme, and an enzyme facilitates something to happen. So in this case, it facilitates the breaking down of carbohydrate. So you can do a little experiment. You can take a piece of bread and hold it in your mouth. Don't chew it, don't swallow it, hold it in your mouth. And the longer it stays in your mouth, the sweeter it gets. It's taking a complex carbohydrate, bread, and breaking it into its smaller component pieces, and the smaller those pieces get, the sweeter they get. Another example where you can see something going awry is in head and neck cancer. In someone who's had head and neck cancer and they've had radiation to the head and neck, what ends up happening is you end up not being able to produce saliva. So what happens is you have to have foods that are moistened. So instead of having an apple, you might want to have applesauce. Instead of having a potato with no gravy or margarine on it, you actually may want to put some gravy or margarine on it to moisten that food. And so, or you can also put in artificial saliva to help to moisten that. So again, most of us don't appreciate what can go wrong until it goes wrong, and then you have to modify what you're going to eat. Well, after you chew your food, we're going to have this series of one-way valves that takes food from the beginning to the end, and the esophagus is where we encounter that first one-way valve. And that first one-way valve is called a cardiac, meaning heart because it's close to the heart, or lower esophageal sphincter. And certainly when this goes wrong, we end up with gastroesophageal reflux disease. And we're going to discuss GERD and more in a future lecture. But when you get to the stomach, that is a very complex, and I'm going to say underappreciated organ, where the process of digestion, how do you digest your food, satiety, that feeling of fullness, continue. So in the stomach, the food is churned and mixed up with digestive juices. Have you ever had the experience of being really hungry and your stomach is grumbling? Well, that's what's happening, is that the stomach is actually churning in the anticipation that hopefully food is on the way. The stomach is also highly acidic, and most of the time we think of that acid in the stomach as a bad thing where there's real physiological function. But the stomach is so unique, it is protected from its own very acidic contents by what's called a mucin layer. Not mucus, but a mucin layer that lines the stomach. So it's like its own protective insulation in that stomach to prevent it from being auto-digested or digested by itself. So what is the function of this acid? Well, first, it aids in the process of digestion. It helps to take bigger molecules and turn them into smaller pieces. It also kills bacteria. Most of the time, we don't think of bacteria in our GI tract, but literally some estimates suggest that we eat enough bacteria to make over 1,000 people sick every day. But why don't we get sick? Well, part of the reason is bacteria can't live in a really acidic environment. So the next time you decide to live on antacids, what does an antacid do? It goes against acid. It raises the pH of the stomach from something very acidic to something that's basic. That's not always a good thing. That acid in the stomach also helps to activate or make both iron, a mineral, thiamine, a B vitamin, more available to be absorbed. So there are really key functions of that mucin lining protecting the stomach and real functions for that acid in your stomach. Now that mucin lining can be eroded by most notably non-steroidal anti-inflammatory medications. So we all take ibuprofen or we've taken aspirin. Those are examples of non-steroidal anti-inflammatories. So in my world where I take care of athletes, when I have an athlete, a male athlete who has anemia, iron deficiency anemia, it's almost always because he's been taking too many anti-inflammatories. It's worn down that mucin lining, broken it down, and when it's broken down, the acid can now attack that very vulnerable muscular lining in the stomach and causes it to bleed. There may be no pain associated with it. You certainly don't see red blood when you go and have a bowel movement, but nonetheless, it is there, and you can end up having some real significant problems with anemia. So what else does the stomach do? The stomach makes a compound called intrinsic factor. An intrinsic factor is secreted by the parietal cells, a very specialized set of cells in the stomach, secreted by the parietal cells, and what it does is it acts as a key to unlock vitamin B12 from food. So without intrinsic factor, you cannot unlock B12 from food, and it causes a type of anemia, oftentimes referred to as pernicious anemia. So having that intrinsic factor, having those parietal cells make intrinsic factor, is really pretty key. Now I want you to think for a second, in our world of gastric bypass, when an individual has gastric bypass surgery, and I've now made that stomach reservoir much smaller, what does that do? Well, it makes less acid available for the digestion of food. What else does it do? It makes less intrinsic factor, increases the likelihood of a B12 deficiency, and truly people who have had gastric bypass surgery really have to take vitamin B injections for the rest of their life because they don't have as much intrinsic factor. Certainly the aging process also diminishes the amount of intrinsic factor that is produced. And so there's a type of anemia, pernicious anemia, that can be significant in individuals over the age of 50. So the older we get, part of the normal aging process, if you want to think about it that way, the normal aging process is less intrinsic factor. Less intrinsic factor means less vitamin B12 gets absorbed. And again, data is not conclusive on the percentage of people, but we can say it's a significant number of adults over the age of 50. I also really love the function of the stomach and its role in satiety and fullness. In our stomach, we don't have a calorie sensor. We can't go tick, tick, tick and say, okay, that was a 500 calorie meal. We get no instant feedback. But what we do have in the stomach is what is known as a volume sensor. So we can sense volume, and volume of food makes us feel full. Well, in this day and age of energy bars and foods that have a lot of calories in a small space, there is some thought that what contributes to the obesity epidemic is we eat a lot of foods that don't have much volume. We never trigger these volume receptors in our stomach to say, I'm done, I don't need any more food. And so the challenge for us is, can we create more volume in our meals? And the answer is, sure we can. We have high water volume foods, fruits, vegetables, soup, yogurt, milk, 80 to 90% water on average. And so these high water volume foods stretch our stomach, these stretch receptors are activated, send chemicals to your brain saying, I'm done. So again, think back to your grandma. You always had what was called a well-balanced meal. Lots of fruits and vegetables on the plate. Little did we know at that time that the water in that food helped to trigger that sense of fullness. So here's an example for you. If I gave you 5 large apples, a fruit bowl of apples, and I said, this is your snack this afternoon, you probably would tell me, oh, I can't eat 5 large apples. That's way too much food. Your eye is telling you the volume is too great. You can't possibly eat that volume of food. But if I said to you, I want you to eat a king-size individual bag of M&Ms, still individual, king-size individual bag of M&Ms, you'd probably say, oh, I could eat that, if you're being honest. I can eat that amount of M&Ms. But you couldn't eat 5 large apples. The calories are the same. The calories are the same. The volume is different. So this concept of volume is going to come back over and over when we start talking about weight management, the management of metabolic syndrome and cardiovascular disease. This is going to come back over and over again. Certainly at the end of the stomach, you have what is called a gastric sphincter. It controls the rate of emptying from your stomach to your small intestine. And that's going to be a significant factor when we talk about the small intestine. Now, I do want to give you a heads up that true stomach disorders like gastric ulcers and gastric bypass are going to be covered in more detail in following lectures. But the workhorse of the digestive process, the true workhorse, occurs in the small intestine. In the small intestine, we have a series of digestive enzymes that help to aid in the breakdown of carbohydrate, protein, and fat. So we have this workhorse. So if you were to ask yourself the question, where does most of the digestive process occur? It occurs in the small intestine. Now, certainly certain other organs of the body make their contribution to this process. Bile, for example, made by your liver, stored in the gallbladder, is needed for the emulsification of fat. And to emulsify means that I'm going to take that watery content of the stomach, and now what I need to do is get the fat and the water to mix together. Well, think about this as an example. You've all had Italian salad dressing. And right before you pour it on your salad, what are you doing? You're shaking it up. And when you shake it up, you are making a temporary emulsion. Temporarily, you're mixing that oil and water together. Well, bile's role is to get the watery contents of your stomach and the fat in your meal to mix together so it can be attacked in greater force by these digestive enzymes. So here's a tip for you. Bile is 70% cholesterol. Bile is 70% cholesterol. So what that means is in response to a fatty meal, you make bile. Bile is normally recycled. So we might want to think of our intestinal tract as a green organ. Our gut naturally recycles bile and we don't excrete it. Well, what oatmeal does is the fiber in oatmeal binds to that bile. Instead of the recycling process going on, what ends up happening is that bile is now eliminated when you have a bowel movement. So your body has to make more bile. Where does it get the substrate? Where does it get the building blocks to make bile? If it's 70% cholesterol, what it's doing is removing cholesterol from your blood to make bile, which is needed to emulsify the fat. So when you hear claims for oatmeal lowering your cholesterol, the way it lowers cholesterol is it binds to that bile and causes it to be excreted, or your body now has to make more. So these gummy fibers that you find in oatmeal are certainly going to be a valuable adjunct to the prevention of cardiovascular disease. Now, certainly there are many fiber supplements out there that can be used for the treatment of constipation, and if they're that gumming kind of gelling fiber, can really be used as an adjunct to help to control your cholesterol. So we've got our liver and gallbladder helping us out here in the production and the storage of bile. And now we've got another real workhorse here, and that's the pancreas. The pancreas contributes valuable enzymes as well as hormones. So when we look at it this way, it's got two functions. It's making all these enzymes, lipase, amylase, protease, and that is called its exocrine function. It also has an endocrine function, which means it produces hormones. So this small little pancreas laying kind of close to that small intestine really has a significant role. The most notable hormone release by the pancreas is insulin. And insulin is so important in physiological processing. It's so important in disease management. This hormone is going to come up over and over and over again as we go through our series of lectures. So what is insulin? It's secreted by some specialist cells in the pancreas called beta cells. It transports nutrients from the blood into the cells. It is an anabolic hormone. It is anabolic. What does anabolic mean? It builds, so it transports nutrients. It transports them from the blood into the cells where they can be used. So it's anabolic. This is really pretty significant because anabolic means building. Sometimes it's good to build and sometimes it's not. Well, in human physiology, if we have an anabolic or building hormone, we're going to have a counterpart, and the counterpart here is glucagon. Glucagon's job is to break things down. So I want you to think about this for a second. If you're on a weight loss diet, you want to break down your stored nutrients. You want to release them from the cells where they're being stored, and you want them to be transported to other parts of the body to be used as energy. So I describe this as kind of the yin and yang, the pulley system of human physiology. Insulin gets things in, it's an anabolic hormone. Glucagon releases food, it is a catabolic hormone. Well, the diseases associated with insulin and glucagon oftentimes are lumped under this big umbrella term called diabetes. It's a major endocrine disorder that have two different types, and we'll spend some time in subsequent lectures exploring those. Type 1 diabetes is autoimmune, which means that you actually destroy the beta cells of your pancreas. They are destroyed. Type 2 diabetes is you have enough insulin. You make enough insulin. In fact, oftentimes you make too much insulin, but you just don't use it in an effective way, so the body makes more and more insulin. So again, think with me for a second. If I'm making more insulin than I need, and I can't use it for all of its transporting functions, I've now got a whole bunch of a hormone that says store, 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 and oftentimes people with type 2 diabetes will complain of significant hunger. Part of that is the overproduction of insulin linked with type 2 diabetes. Well, that small intestine, that workhorse of digestion, is about 23 feet long, and the surface area of that small bowel or small intestine is increased by villi. And villi, if you think about it this way, are small finger-like projections that stick out of that small intestine lining like fingers that will significantly increase the surface area. It creates fold upon fold. And if I were to spread the whole thing out, these folds are about the size of a football field. So in that 23 feet long tube, you now have the surface area of a football field to take care of that workhorse load of the digestion and absorption of nutrients. Really pretty significant. So any disorder of the small intestine can oftentimes have malabsorption, poor absorption, because I lost some of that absorptive surface area. So that's a pretty significant finding. Also within those villi, on those, again, think about them as fingers, on those villi, on the very tips are enzymes. It could be the enzymes that digest sugar. Sucrose would have sucrase. Digest malt sugar. Maltose would have maltase. All of those are going to sit on the very tip, and probably the most significant enzyme that sits on the tip is lactase. And lactase digests milk sugar, lactose, into its most basic form so it can be absorbed. So think about this for a second. You've had diarrhea, you've had a digestive disorder, and with diarrhea, you shave off the tips of those villi. Well, temporarily, you may not be able to digest milk at all. You may end up with worsening diarrhea that it'll go away over time, but in the meantime, you're going to have some issues in digesting milk sugar. So a question I get all the time is, after I've had diarrhea or after I've had anything that's going to wipe out those tips of the villi, how long does it take for them to regenerate? Only in the range of 3 to 5 days, depending on your overall health and conditions. Only 3 to 5 days. So temporarily, you may have to stay away from milk sugar, but for most of us, it's not going to be permanent. Within the crypts of those villi, within the very deepest recesses of the villi, are what are called Peyer's patches. And Peyer's patches are immune-secreting lymphoid tissue. So when people say, I have a healthy immune system, if I were to ask you, where does your immune system reside? Most of us have no clue. But a good percentage of your immune system lays in your gut. Now, why would it be there? Well, think about it. If I'm eating all this bacteria, I've consumed all this bacteria as part of my normal food supply, whatever escapes that hydrochloric acid in the stomach can now be taken care of by immune-secreting lymphoid tissue within that small intestine. So diseases of the small intestine, again, anything that's going to impact the overall health and well-being of the small intestine, can actually increase the likelihood that you end up with some other form of infection because you have really no way of secreting all the immune secretions you could normally secrete. Crohn's disease is an example, and certainly we'll cover that in a later lecture. The large intestine finishes the work of digestion in about 12 hours. So that transit time from when I eat my food until when it's actually excreted can be up to 12 hours. Now there's lots and lots of reasons that can alter that, but in essence we're looking at about 12 hours. It is connected to the small intestine by, again, that series of one-way valves. The valves are designed to go in one way. So you might consider it north to south, but it's designed to go one way. The large intestine really controls fluid balance. So if you're dehydrated, your large intestine is going to pull water out of the waste products that are in your large intestine, pull them out to increase the amount of water that you have in your blood. So that's the primary role. Food, remember, food is absorbed in the small intestine. So for individuals who are abusing laxatives and think it's a way of losing weight, you really aren't absorbing food in your large intestine, and that's where laxatives work. So you're absorbing food in your small intestine, fluid in your large intestine, so kind of keep that in mind. You may lose weight, scale weight, by taking laxatives, but you're not going to impact calorie balance, and so that's an important distinction. Certainly within that large intestine is oftentimes where people end up with one of the more common GI diseases, diarrhea. And diarrhea can cause, be caused by GI irritants, and there's a significant number of GI irritants that we'll explore. But the losses of fluid can be excessive, and oftentimes if the diarrhea is caused by, for example, food poisoning, the losses of fluid can be more than you can make up voluntarily, and that's why oftentimes people with significant diarrhea really have to go to the emergency room or to the physician and get what I call rescue fluids. So what are other causes other than food poisoning? Well, certainly any concentrated solution that is dumped into that small intestine faster than it can be processed can cause what is known as dumping syndrome. Literally, the food is dumped from the stomach to the small intestine in a super concentrated form. And when it's in a super concentrated form, the body's job is to pull water to dilute it. So all along the GI tract, and particularly in that large intestine, fluid is being dumped in an attempt to keep that concentration solution in a manageable form for the gut. So I think the challenge is in individuals, for example, who've had that gastric bypass, oftentimes what happens if they eat more food than they should, that concentrated solution in the stomach is dumped into the small intestine, water is pulled in, and you can have significant diarrhea. Certainly inflammatory bowel disease can cause diarrhea as well, and if you've ever had food poisoning can cause diarrhea that oftentimes needs those rescue fluids. Antibiotic use. Now keep in mind, the villi of that small intestine, if an antibiotic comes in as a gastric irritant and irritates those villi, the villi flatten and you can malabsorb food. So I think antibiotic use can cause diarrhea for two reasons. One, it flattens the villi, and two, within that large intestine, you're supposed to have healthy bacteria that live there. And antibiotics will kill the bad guys, the things you want to get rid of, but they also kill the good guys. And in killing the good guys, what ends up happening is now I don't have the really good guys that help to process food and digest fiber and all the other wonderful things that those bacteria do. So in essence, antibiotic use can be a major source of diarrhea for individuals that are on and off antibiotics. So a tip might be that if indeed that is you, and for whatever reason you are on and off antibiotic therapy, keep in mind that you want to kill the bad guys, but in this case you can replace them with good guys. And where do I get good guys? Where do I get healthy bacteria? Well, certainly healthy bacteria, for example, can be found in yogurt. Yogurt is a great source of what are called probiotics, and these probiotics are actually the type of bacteria that your gut needs to function. So if you have significant diarrhea, what's your first line of defense? It's fluid, fluid, and fluid first. Then if it's from malabsorption, some really light carbohydrates. So say, for example, you've had horrible food poisoning, your first goal would be, can I get adequate amounts of fluid? Now certainly I will tell you adequate amounts of fluid should have some electrolytes. So it might be an oral electrolyte replacement fluid like you'd give babies, or it could be a sports drink, because what you're really trying to do is get fluid and electrolytes back in. The carbohydrates should be easily digested, so it might be things like white rice, a potato, something along those lines, plain pasta, in order to get some nutrition back in that might have been lost. You also may want to eliminate substances in foods that are not absorbed well. So for example, in the recovery from chronic diarrhea, you may want to stay away from some fibrous foods if they're irritating you. And then there are some fibrous foods like oatmeal that may actually help to slow the transit time. So this becomes a little confusing for consumers, and so as we cover the lecture on fiber, this will be made a little bit more clear. So in essence, fiber may help control the diarrhea, or fiber may hurt the diarrhea. It really depends on the type. There's an individual basis for the tolerance of fat, fiber, and lactose, and so I think there's some challenges here. So if indeed as part of my GI disorder I'm malabsorbing fat, I'm losing fat in my stool, that's where the specialized product called medium chain triglycerides comes in. Medium chain triglycerides are absorbed and utilized in your body a little bit different than regular fats are, and so they can be a valuable adjunct in just keeping your calories high enough if indeed you've got a chronic gut disorder that's causing that diarrhea. Constipation, one of the most common intestinal problems in Western societies, and studies vary. And some studies will suggest it's as little as 5% of the population have problems with constipation, up to 25%. So a lot of it just depends on the research that you read. Now, what are the causes of constipation? They're multifactorial, just like they are for diarrhea, but the cause can be long-term use of iron compounds. So for anybody who's ever had children and took supplemental iron during their pregnancy, oftentimes have a real issue with becoming constipated with iron. Ironically, large amounts of laxatives actually loosen some of the tone in your large intestine and can actually lead to a laxative dependence. And so if you find that you've been consuming laxatives, this is something that you really need to see your physician about for alternative ways. Certainly stress. Stress can alter the way your nervous system performs. It can shut down that last sphincter, that last one-way valve, and cause some difficulty having a bowel movement. And certainly things such as low fiber intake, which honestly is a cause for most Americans. Low fluid intake. Remember that large intestine is going to pull fluid out if you're dehydrated. So if I'm dehydrated and I'm pulling the fluid out, what does that mean? I'm going to end up with harder waste products in my large intestine. And lack of exercise. I describe exercise as an internal massage. Exercise massages and moves around your gut, increasing the motility or the movement of that. And sometimes there can be an actual obstruction of the GI tract, and it's oftentimes with food. The treatment of constipation, that treatment is adequate intake of fiber, and those details are going to be in an upcoming lecture. Certainly men under the age of 50 should eat somewhere in the range of 38 grams per day, but a lot of that really depends on how many calories. Women under the age of 50, somewhere in the range of 25 grams per day. The challenge is, do you know high fiber foods? And so I love it when numbers like this are published, but if they're published and you don't know where to get that fiber, I'm going to suggest that, again, the upcoming lecture on dietary fiber may help to clear that up a little bit for you. And certainly increase exercise. In the management of most of the diseases that we're going to cover in this course, increased exercise is going to come up over and over and over again. And I'm going to suggest that increasing exercise is a great way to stimulate a bowel movement. Now, certainly there'll be people who can't go out and exercise, say, for example, if you're wheelchair bound, but this is where a physical therapist may be able to give you some exercises that would help. Certainly, diverticular diseases and other diseases of the lower GI are going to be covered in much more detail in a later lecture. So what we're trying to do with this is give you this tour from beginning to end on how do we at least have a framework for understanding the GI tract. Now, a question that I usually get is, somebody in my family's got horrible gas. Do you got any help for that? Is there anything that you can give as a solution? Well, gas can be swallowed or ingested, so like carbonated drinks, whipping cream, anywhere where air is incorporated in. I will tell you, people who drink from a straw, for example, actually get in more air than maybe they know. So I will tell people to slow down when they eat. You don't want to have really foods that have a lot of incorporated air, like carbonated beverages, and those would be some easy tips early on to, again, reduce the amount of air that you're actually swallowing. Another example of where people can swallow air is when you chew gum. If you chew a lot of gum, oftentimes you're actually chewing in some additional air, if you want to think about it that way, chewing in some additional air, and what ends up happening is if the air goes in the gut, it's going to have to go out the gut. Certainly some acidic foods can promote gas formation, spaghetti sauce, citrus fruits, vinegar, and pickles. Certainly if you have a sugar alcohol, and a sugar alcohol is often found in sugar-free foods, and again, it ends in that suffix of OL. So if you're chewing a lot of sugar-free gum, you're getting a twofer there. One, you're swallowing some additional air, and two, those sugar alcohols are actually fermented in your gut. And when they're fermented by the bacteria, they're going to cause gas. So certainly those are going to be a couple things that you want to think about when you think about that undesirable side effect of gut digestion called flatulence or gas. Thank you very much.